If you're over 60 and having a heart attack right now, the next 90 seconds of what you do or don't do will determine whether you survive with full recovery or suffer permanent heart damage. A 2024 American Heart Association study tracked 12,000 heart attack survivors over 60. Those who followed the correct first 5 minutes protocol had 73% better survival rates and 64% less permanent heart damage than those who didn't. But here's the terrifying part. 82% of seniors did the wrong things in those critical first minutes. Things that seemed logical but actually made the damage worse. And mistake number 3? It's what 91% of people do instinctively, and cardiologists say it's the single deadliest error you can make during a heart attack. This isn't theoretical. Every 40 seconds, someone over 60 has a heart attack, and what happens in the first 5 minutes determines everything: brain damage, heart function, survival, quality of life. Drop a comment right now. Do you know the warning signs? Have you or someone close experienced a heart attack? I'm Dr. Hinohara, and today we're covering the exact protocol that could save your life or the life of someone you love. Before we dive into the protocol, you need to understand why heart attacks are deadlier for people over 60. First, symptoms are often atypical. The classic crushing chest pain? Only 43% of seniors experience it. Instead, you might feel nausea, jaw pain, extreme fatigue, or shortness of breath. Many dismiss these as indigestion or aging. Second, the damage window is shorter. After 60, your heart tissue has less capacity to survive oxygen deprivation. Every minute without blood flow destroys heart muscle that won't regenerate. Johns Hopkins found that seniors who delayed calling 911 by just 10 minutes had 40% more permanent heart damage than those who called immediately. Third, seniors are more likely to be alone when it happens. No one nearby to help, no one to notice symptoms. This isolation increases mortality by 56%. A Mayo Clinic study found that 68% of senior heart attacks occur at home, often during rest or sleep, not during exertion like younger adults. So, let's count down the 5 critical actions you must take in order, starting with what to do in the first 30 seconds. Action number 5. Recognize the atypical warning signs that seniors experience. Forget the Hollywood heart attack, clutching chest, dramatic collapse. In people over 60, symptoms are often subtle and easily dismissed. The American Heart Association identified the most common senior heart attack symptoms: unexplained extreme fatigue, suddenly feeling exhausted for no reason. This occurs in 71% of women over 60 having heart attacks. Jaw, neck, or back pain, not chest pain. 48% of seniors report this as their primary symptom. Nausea, indigestion, or stomach discomfort, often mistaken for food poisoning or acid reflux. Shortness of breath without exertion. Difficulty breathing while sitting or lying down. Cold sweat and dizziness suddenly breaking into clammy perspiration. Sense of impending doom, an overwhelming feeling that something is terribly wrong. A Cleveland Clinic study found that seniors who recognized these atypical symptoms and acted immediately had 58% better outcomes than those who waited for classic chest pain. Trust your instincts. If something feels profoundly wrong, different from anything you've experienced, assume it's your heart until proven otherwise. Every minute you spend convincing yourself it's nothing is a minute of heart muscle dying. Action number 4. Call 911 immediately. Do not drive yourself. Do not have someone drive you. Call 911. This seems obvious, but a Stanford emergency medicine study found that 47% of seniors either drove themselves or had family drive them to the hospital instead of calling 911. Why this is deadly? Ambulances carry cardiac equipment and trained paramedics who can start treatment immediately. They can administer oxygen, nitroglycerin, aspirin, and perform ECG monitoring during transport. If you go into cardiac arrest in a car, you die. In an ambulance, you have a 60% survival chance. Ambulances also notify the hospital you're coming. The cardiac team is ready when you arrive. This cuts door-to-treatment time by an average of 38 minutes. The American College of Cardiology found that heart attack patients arriving by ambulance received life-saving treatment 43 minutes faster than those driven by family. 43 minutes. That's the difference between full recovery and permanent disability. When you call 911, say clearly, "I'm having a heart attack. I'm over 60. I'm at your address." Give your address twice. Stay on the line. Do not hang up to call family. The 911 operator needs to stay connected with you.
Action number 3. Take 325 milligrams aspirin immediately, but only if you're not allergic and not on blood thinners. Aspirin works by preventing blood clots from getting larger. Heart attacks are usually caused by clots blocking coronary arteries. Aspirin thins the blood instantly. A landmark study in The Lancet found that taking aspirin within the first 5 minutes of heart attack symptoms reduced mortality by 23% and heart damage by 31%. Here's the critical part. Chew the aspirin, don't swallow it whole. Chewing allows absorption through the mucous membranes in your mouth, getting it into your bloodstream 4 to 5 times faster. Use regular aspirin, not coated. Coated aspirin delays absorption. If you're on blood thinners like warfarin or Eliquis, or if you have a known aspirin allergy, skip this step. Tell the 911 operator this information. Keep aspirin in multiple locations: your bedroom nightstand, kitchen, car, purse. Not in a pill organizer. In the original bottle so paramedics can see exactly what you took. Harvard Medical School found that seniors who took aspirin before paramedics arrived had significantly smaller infarct sizes, less dead heart tissue than those who waited. Action number 2. Sit down immediately or lie down with your upper body slightly elevated. Do not remain standing. This is counterintuitive. When panicked, people pace. But standing during a heart attack is dangerous for 2 reasons. First, gravity. When you're standing, your heart must work harder to pump blood upward to your brain. During a heart attack, your heart is already struggling. Don't make it work against gravity. Second, syncope, sudden loss of consciousness. 34% of seniors experiencing heart attacks briefly pass out. If you're standing, you fall and potentially suffer head trauma or broken bones on top of the heart attack. University of Washington Emergency Medicine found that seniors who remained standing during heart attacks had 28% higher rates of additional injuries from falls. Sit in a sturdy chair with armrests or lie on the floor with a pillow under your head and upper back. This position optimizes blood flow to your brain and heart. Loosen any tight clothing belts, collars, bras. Remove glasses if lying down. Stay still. Do not walk around gathering belongings. Do not go to the bathroom. Do not brush your teeth or change clothes. Every physical movement increases your heart's oxygen demand at the worst possible time. Conserve energy. Your heart needs every available resource to keep beating.
Action number 1. Control your breathing and stay as calm as possible. Do not panic. This is the hardest action because panic is automatic. But panic is also the deadliest mistake you can make. When you panic, your body releases adrenaline and cortisol. These hormones increase heart rate, raise blood pressure, and make your already struggling heart work exponentially harder. A study in the Journal of the American College of Cardiology found that extreme emotional stress during a heart attack increased mortality risk by 47%. Here's what to do. Focus on slow, controlled breathing. Breathe in through your nose for 4 counts. Hold for 2 counts. Breathe out through your mouth for 6 counts. This activates your parasympathetic nervous system, your body's calming mechanism. It slightly lowers heart rate and blood pressure, buying your heart precious time. If you're alone, talk yourself through it out loud. Help is coming. I called 911. I took aspirin. I'm sitting down. I'm breathing slowly. Speaking out loud keeps your mind focused on actions, not fear. If someone is with you, have them talk to you calmly. Have them count your breaths with you. Stanford Cardiac Care Unit found that heart attack patients who practiced controlled breathing while waiting for ambulances had 19% better ejection fraction outcomes, meaning their hearts pumped more effectively after recovery. Now, here's what absolutely not to do. These are the deadly mistakes.
Don't cough repeatedly. There's a myth about cough CPR saving yourself during a heart attack. It's false and dangerous. It increases pressure in your chest and can worsen the attack.
Don't take nitroglycerin unless already prescribed to you. If you have prescribed nitroglycerin, take it as directed. But if it's someone else's or you've never taken it, don't start now. Don't drink water or eat anything. Your stomach should be empty in case you need emergency procedures or anesthesia. Don't refuse to go to the hospital. Some seniors fear being a burden or worry about costs. Your life is worth more than money. Treatment can't help if you're not there. Don't wait to see if symptoms improve. Heart attacks don't resolve on their own. Hoping it goes away is a fatal error. So here's your complete 5-minute protocol. Action 5. Recognize atypical symptoms: fatigue, jaw pain, nausea, shortness of breath. Action 4. Call 911 immediately. Don't drive. State clearly: heart attack, over 60. Address. Action 3. Chew 1 325 and regular aspirin if no allergies or blood thinners. Action 2. Sit or lie down with upper body elevated. Stay still. Action 1. Breathe slowly and calmly. In for 4, hold for 2, out for 6. These 5 actions, done in this order within 5 minutes, can be the difference between full recovery and death.